Good afternoon. I am Rachel Makalorito of the College of Nursing and Health Sciences of the Holy Trinity University from Puerto Princesa City, Palawan. Together with my colleague, Ms. Lorelai Doblado, RNMAN, it is our privilege to present to you our output in the courseware development for the Bachelor of Science in Nursing with the course on Nutrition and Diet Therapy. For the course information or description, this course deals with the study of food in relation to health. It covers nutrients and other substances and their action and interaction and balance in relation to health and diseases and the process by which organisms ingest, digest, absorbs, transports, utilizes, and excretes food substances. It will focus on the therapeutic and food service aspects of the delivery of nutritional services in hospitals and other healthcare institutions. For the intended learning outcomes for the course program, at the end of the course and given relevant, actual, or simulated situations or conditions, the students will be able to apply knowledge of physical, social, natural, and health sciences and humanities in nutrition diet therapy. They are also expected to provide safe, appropriate, and holistic care to individuals, families, population, group, and community utilizing the nutrition care process. To apply guidelines and principles of evidence-based practice in nutrition and diet therapy. To practice nursing in accordance with existing laws, legal, ethical, and moral principles related to nutrition and diet therapy. To communicate effectively in speaking, writing, and presenting using age and culturally appropriate language in nutrition and diet therapy. Document client care in nutrition and diet therapy accurately and comprehensively. To work effectively in collaboration with intra, and multidisciplinary and multicultural teams in providing nutritional care. To practice the beginning management and leadership skills using systems approach in nutrition and dietary management of the client. To engage in lifelong learning with passion, to keep current with national and global developments in general, and nutrition and dietary management in particular. To demonstrate responsible citizenship and pride of being a Filipino. To apply techno-intelligent care systems and processes in nutrition and diet therapy. To adapt the nursing core values in the application of nutrition and diet therapy. To apply entrepreneurial skills in nutrition and diet therapy in the delivery of nursing care. For the unit intended learning outcomes, at the end of this unit, the students are expected to provide health education in nutrition and diet therapy to targeted clientele. In this unit, particularly the pregnant and lactating women, infants, and children. To ensure a working relationship with the pregnant, infant, and child, and healthcare team based on trust, respect, and shared decision-making in achieving the desired outcomes of nutritional care. To implement safe and quality interventions with the client to address the nutritional needs, problems, and interventions with the client to address the nutritional needs, problems, and issues. Collaborate with other members of the health team in the implementation of programs and services related to nutritional care. To use appropriate technology for effective and efficient implementation of nutrition plan. For the teaching and learning activities, this include pregnancy and lactation. In the pregnancy and lactation, it includes calorie allowances, protein allowances, calcium allowances, iron allowances, vitamin allowances, food allowances for pregnant and lactating women. Next would include complications of pregnancy and possible dietary modification in the course of the complication or disease. Next, nutrition throughout the lifespan. Childhood. First, we have the infant. So we're going to discuss first what are the diet that is prescribed for an infant. And what are the nutritional requirements that is recommended and should be attained by an infant? For the third, we have the food for infants at about 3 months old to 12 months old. Fourth, we're going to have learning activities concerning how to feed an infant. Next, we will have the common disorders that are usually encountered or experienced by an infant, and to know the indicators or the indications of a good nutrition to an infant client. And lastly, we're going to prepare some easy to prepare baby foods for our infant. For the next study guide, the teaching and learning activities focuses on the nutrition throughout the lifespan, specifically on the preschoolers and school-age children. First, we're going to have learning activities that is on food needs of preschool children. Next would be the nutrient and nutritional allowances for preschool children. Students will be able to perform also or conduct meal planning for preschool children, more activities concerning feeding problems, and indications of good nutrition of a preschooler children. And lastly, students are expected to perform or prepare nutritious merienda recipes for growing children.
Good day. So to continue the teaching and learning activities, we have the following activities set for the students. So we have some guide questions for them to answer and reflect on. And then there will be case analysis. So scenarios will be given. So they're going to compute for desirable body weight and total energy requirement. Also, they are going to calculate planned diet providing 3 meals and 2 snacks. And then lastly, a group presentation will be done. So we will give them guide questions for that. So here are the examples of some questions that they're going to answer. So what nutritional advice is recommended for healthy pregnancy in lactating women and in children from infancy to preschool, childhood to preschool? And then what are the different factors to consider in planning a menu for growing children? So we're going to present a sample menu plan. So here are the examples of case analysis. So these are the scenarios that will be given per group. So for group 1, here is the scenario. Group 2, group 3, and group 4. Also, as part of their group presentation, they will be asked to prepare a signed sample menu plan for class presentation. So per group, we assign per meal. So for example, in group 1, they are going to present lunch meal. For group 2, lunch meal as well. Then for group 3, should include the complementary feeding. Also, PM snacks should also be discussed by group 4. And then group 5, breakfast meal. And then lastly for group 6, dinner meal. Okay, so here are the example or sample menu plan that they are going to follow. So of course, they're going to apply this on their assigned age group. So from breakfast to complementary feeding or the snacks, the lunch, up to dinner, including the snacks, of course. So this is a specific sample menu plan for children 7 to 9 years old. So these are the recommended daily servings. So the student should come up with this plan, with this kind of plan. So what are the course resources or the tools that we use? So resources, so we use the following resources so we can have the following references. So textbook as well as online or websites as references. So these are the textbook that we use. For the assessment, so we are going to assess the students according to their output using the Google Workspace or LMS. So they're going to present it. They can use the Jamboard, they can use the Google Class, etc. Then, of course, the participation to the discussion board. Class attendance will also be included their class participation, recitation, and of course their compliance in terms of submission for their weekly assessment tasks. And also quizzes and examinations will be given. Of course, the output of their menu plan. So this will be accomplished through activity manual, of course their sample menu plan, and then their reporting, and then their nutrition and diet therapy portfolio for the entire subject. And then they're going to submit also articles on current trends and issues in nutrition and diet therapy, also including the different scenarios as their quiz analysis per age group. To summarize our topic, so we can say that the food we eat plays an important role in our health and well-being. So good nutrition contributes to quality of life, helps maintain health body weight, protects against infection, and reduces the risk of chronic conditions and premature death. Chronic conditions, often linked with a poor diet, are the major cause of ill health. So that is why it is important in nursing for nursing students to understand this concept. So it is during the body's growth periods that the need for nutrition or nutrients is greatest. This occurs during infancy, adolescence, and pregnancy. Once the growth period stops, energy needs and the need for certain nutrients decline. The National Dietary Guidelines, as well as here in our country, supports optimal nutritional and health outcomes for the population and how this differ across the life stages. So that would be all. So that are the contents of our courseware. Thank you for listening and have a good day. Thank you very much.